action.
Hi there, my name's Marissa. I'm a student physical therapist. May I work with you today?
Yeah.
Awesome. Yeah. Awesome. Okay, well, today we are going to be looking at your wound. Well, I'm going to be looking at your wound. We're going to change your old dressing, put a new one on, and I'm just going to check if it's healing properly, as it should. Are you experiencing any pain in your wound right now?
Yes.
Yes? Okay. I would like you to rate it on a scale from 0 to 10, 10 being the worst pain. What would you give it?
A 4.
4? Okay. Well, we'll see if we can get that down a little bit after I clean it and kind of look at it, okay?
All right.
All right, so you can just hang out here and I'm going to go get my area set up. Yes. First, clean the table. This is my clean designated area. Give it a good wipe down. Make sure I get the sides and the edges. Okay. Next, I'll clean my pen and my spray bottle. Make sure that's all clean. Get the bottom. Okay. Next, I'll move my trash can to a better spot. All right, and now I'm gonna wash my hands. All right, after my hands are clean, I'm gonna set up my table area. So first, this will be my clean side. And I can put that over there, my hands are clean. And then this will be my dirty side for anything that I need to put over here later. Next, I'll put my clean supplies over here. Gloves. Perfect. Next, I'm going to put my PPE on. All right, if I could have you, my tech, tie my gown for me.
Sure.
Okay, yeah. Wait, top and bottom, please. Scoot out a little bit.
You're set.
Thank you. All right. My gloves on. Glasses are fogging up. Okay. All lay these towels here while I clean your wound. Perfect. All right, how does that feel?
Good.
Okay. All right, well, next I'm gonna take off this dressing, okay?
Okay.
So I'll be pulling the skin back just to make sure that, you know, the skin doesn't come up with it. I can get this tape. There it goes. All right. So looking at the old dressing and the wound, I smell minimal odor and there's minimal exudate. The exudate being serious sanguinous. So dispose of that. And then we're gonna clean your wound and making sure that I'm going from inside out of the wound. Cleaning the peri wound, same thing, starting from the like inside, going out, or going from the edges, going out. Good. Okay. Alrighty, now I'm gonna take off my gloves. And we're just gonna do a little measurement here with the tape. Make sure it's big enough. Good. Okay. Put on my new gloves here. All right, we're gonna do some measurements, okay, on your wound. So this will be the head, which will be 12 o'clock, and then this will be the bottom, which will be 6 o'clock. So I'm gonna first measure the length, which is from 12 to 6. And I get 5.1 centimeters. The width would be perpendicular to that from 3 to 9. And I get 3.1 centimeters. And next I will measure the depth. So looking for the deepest part of the wound, say about there. And for the depth, it's 1.1 centimeters. Then I see some tunneling at 10 o'clock, and I'm gonna take the depth of that, which I get 1.1 centimeters. And then I see some undermining from 12 to 3, so I'm also gonna get the depth as that as well, which that is 0.8 centimeters. Toss those. Now just looking at the wound here, we can see that we have 60% of the red viable granulation tissue. We have 30% sloth, which is the yellow, and then over here we have 10% eschar, which is the black necrotic tissue. The wound edges are attached except for at 10 o'clock where the tunneling is, and then from noon to 3 where the undermining is. Peri-wound wise, everything looks fine. There's no signs of infection, maceration, or dryness or anything. So everything looks good there. Now we're gonna go ahead and pack your wound or put a new dressing on. So I'm gonna take my peri-wound protectant. And clean around. Making sure it stays nice and healthy. And we're going to toss that. Next, I'm going to get some 2x2s for my secondary dressing to pack the wound. Making sure that I'm kind of getting in that tunneling and undermining area as well. Okay. Next, I'll take my 4x4 as my secondary. No, sorry. Okay, there we go. My secondary dressing, and then tape it in the window pane method so it stays on there good till tomorrow when I come change it again. Okay. So I got that. A document. I'll do my initials. What's the time, Tech?
2 o'clock.
2 p.m. And it's 3:14.
Yep.
24. Okay. Alrighty. So the dressing is complete. Everything looks pretty much good. There is some tissue that we'll keep an eye on as I come, in here daily to change it. But I just wanted to educate you on some things that I saw. So this is a pressure injury, which is located just right above your bottom at your sacrum. So what this means is we're going to put you on a turning schedule. I can help you, or the nurses and your family members, to make sure that you're turning on your right side, your left side, or laying on your stomach. Basically, we want to be off of your back and bottom area to relieve pressure to this area so it can heal quicker. Also, make sure that you're eating the meals that the nurses or your family is giving you, because nutrition really helps speed the healing process of your wound faster. And just make sure you're hydrating. If you have any issues, concerns, or questions, the call button is right there. I'll be here, or a nurse can come check on you. Does that sound good?
Yeah.
Do you have any other questions at all? Do you have
No.
any other? Okay. And then, okay, so now that that's all good, how are we feeling? I know you said you had some pain earlier. How about right now?
A little bit.
Okay. Can you give me a number on the 0 to 10 scale again?
Probably a 2.
A 2. Okay, that's good. Well, hopefully it'll stay there. I'll come check on you tomorrow, and we'll report back, okay?
Okay.
Alrighty. So, I would remove anything that I contaminated, and then I'll remove these as well. Put this in the dirty laundry. Perfect. Not anything here, everything was clean. So now I'm going to take off my PPE. Do you mind helping me?
Yes.
Tie?
Give me just a second. Okay.
Okay. Okay. Here we go. Okay. Now that that is off, I'm going to put this in the dirty laundry. Take my gloves off. And then my glasses can go back in my clean area. Okay. Hand sanitizer. Now I'm gonna just clean up my area here. So these are all clean. So put that back in this clean area, and then clean those bottom of the bottle. Sides. Okay. And now these can go in the dirty laundry as well. Spray off this one last time. Make sure it's extra clean. Get the tops and the sides and the bottom. And then I would wash my hands again.